Well, I think it is a difficult area because I've taken antidepressants myself. I suffered 2 serious depressive episodes. And when you're incredibly ill, and indeed, in my case, suicidal, you are desperate for help, and drugs are what are offered to you. Now, having said that, and having been a mental health advocate and an ambassador for SANE and Rethink Mental Illness and been in this field, there's been growing disquiet and unease about antidepressants for at least 5 years. So this study is the culmination, really, of lots of concerns. So there's concerns about efficacy, there's concerns about side effects, and there are concerns about withdrawal. And what I would say is it leaves the patient in a very difficult position because the suffering is very real.
And I guess, Rachel, is it that we've increased our use of antidepressants because of cost, effectively, particularly in the NHS, because to have a therapist that you can have talking therapy with, be it CBT or some sort of hypnosis, is more expensive, perhaps, than just handing a patient a pack of pills?
Absolutely. I mean, we are in a culture of a pill for every ill, and this is the case on lots of metrics, though it is beginning to change. So the NICE guidelines on what to do if you're a GP, if somebody comes to you with low mood, it used to be that antidepressants were the first port of call. And the advice now to GPs is they should take a pause and that it's not an instant answer. I think you're absolutely right. The GPs are in a very difficult position. Of course, psychological counselling, talking therapies, a great idea. There are long waiting lists. People often come in at the last resort when they're already feeling really desperate. And equally, as you say, there's the low cost. It's quicker. You may only have 8 minutes on the clock to see a patient. And what are you going to do? Give them, let them go away empty-handed. So yes, we're beginning to try and think of other ways of dealing with this crisis. We've got nearly 8 million people on antidepressants, but the big question now are what are the options? What else is there? What are we going to be offering people who are really suffering?
This is one study, Rachel, and it does beg the question, what was funding the previous studies, if I may ask that slightly mischievously? If they have been a clinical trial funded by a drug manufacturer, they're going to draw a conclusion that maybe an independent survey might have found. Has that played a part, do you think, in 20-odd years, 40, 50 years maybe, of increased antidepressant use?
Well, I'm afraid this has been a very worrying subject, and there's some fantastic work by people like academics like Dr. James Davis at Roehampton, who did a book called Cracked. And it's exactly as you say, it's looking at the way the pharmaceutical industry presented some of the evidence, held back some of the less encouraging data. Having said that, I don't totally go for the sort of conspiracy theory. I think there is a desire to help people. But having said that, more and more of these studies are saying that maybe there's just a placebo effect with antidepressants. There is sort of mixed evidence. And it's, as I say, it is difficult for the patient because you still got the Royal College of Psychiatrists saying, keep on the medication. And as I say, there aren't easy options about what else people are supposed to do. But what I really think is we need masses of more research. Roughly, there's about £40 goes into cancer research compared to research into psychological disorders. We've got no Crick Institute for sort of mental health research. It's been the poor relation across the NHS. And that's what we really need is, OK, let's accept that things aren't as simple. It isn't this serotonin imbalance. I don't think anybody views that now as the sort of simple answer. But then what are we supposed to do?